Let's discuss Standard 1, support for DSMES services. Standard 1 states that the DSMES team will seek leadership support for implementation and sustainability of DSMES services. The sponsor organization will recognize and support quality DSMES services as an integral component of diabetes care. Sponsor organizations will provide guidance and support for DSMES services to facilitate alignment with organizational resources and the needs of the community being served. Now, I know that's a mouthful, but again, when you're reviewing the national standards, these are kind of the statements that are going to kind of dig into all of the details of what you need to do for Standard 1. So the updates to Standard 1 include that from 2017, Standards 1 and 2 were consolidated. And really what that was, that was done was to really recognize that organizational support is one of the most important indicators of sustainability for DSMES. And there's really no evidence to support inclusion of a separate mission statement and goals for the DSMES service outside of the sponsoring organization. And the recommending stakeholders outside of the organization if needed, and it is strongly encouraged to do so. And that's, again, within the standards, within ERP, stakeholders is kind of the bread and butter of this particular standard. So why is Standard 1 important? You know, we have to shout from the rooftops what we all do within our services. And so again, when we think of the organization and service, it really facilitates that alignment with the organizational resources and community needs. And community needs, I need you to keep that in mind as well. For the team, it just helps to implement, market, and sustain the service. And then for that person with diabetes, it's really going to increase the communication and collaboration with the service itself. So again, this is an important standard for everyone. Now, when we look at the interpretive guidance and the indicator, so again, as you see that the DSMES team will seek leadership support for implementation and sustainability. And then you can see that this interpretive guidance right here, the support can be from expert stakeholders or, again, community stakeholders, and we're going to get into that in just a few, that are going to provide purposeful input and advocacy. Again, we cannot work in a bubble. We need to make sure that that everyone within the organization and those that are touched by the service understand the value of the service, and then their voices are also part of your service too. And so we have these two indicators here, is that identifying those external service stakeholders and how each may provide input and advocacy. And then we want to select stakeholders and make sure that we're reviewing and revising them annually. Now, this is the Standard 1 template that is available on the ERP site. So again, it allows you to kind of, which recognition year you're in, when that annual review and revision date is, what your anniversary month and day are here. And then you're going to put each of the stakeholder names and what they're going to be able to do for your service. So giving just an example, again, also on the ERP site within the QC guide, this is just a nice example, their anniversary date here, which recognition year, and then when they've reviewed and revised. And so again, each of the stakeholders and how they've provided that input and or advocacy. Now, who should be on this list? Again, certainly think big. Again, anyone who can support or enhance your DSMES service. So we want to, some of those examples that you saw on the previous slide, and you're going to see some additional examples soon too, is previous participants. So again, you have any rock stars that came through your service that can kind of help shape how the service can grow and or kind of change to meet the needs better. Any representatives of pharmaceutical and device companies. Again, remember that these folks, again, they're going to other primary care offices, they're going to all of these other offices, and they're a great advocate for all of you to be able to kind of shout again that your service is quality and that it's available. And, again, it's a nice collaboration to have. Again, billing experts. So yeah, again, or Medicare, Medicaid experts. So again, your billing folks within your organization, they're wonderful resources to be able to help you to kind of better navigate, reimbursement and how you're billing and all of those things. So I do strongly encourage that you include these folks. Any providers who refer to your service is, again, definitely just making sure that you have some champion that you have on that on your external stakeholder list. I cannot say enough the value of having community programs involved. And again, this could be anyone, again, churches, places of worship. Again, I have to say that they have the ear of their congregation. And so again, making sure that you're connecting with these places of worship, especially in certain regions, again, with very high incidences of diabetes, again, a great thing to collaborate and make sure that they're part of your external stakeholders. Again, also depending on where you are in the country, local barbershops, hairdressers, again, any gathering place for local community members, again, a great place that, these places are doing a lot of outreach, and they see a lot of people with diabetes. So again, make sure that you're kind of looking at some places that you may not always consider options, but these are some great ones, especially in bigger cities. Because again, the barbershops and hairdressers, again, see a lot of people with diabetes. Also the senior and community centers. So again, connect with these folks and identify how you can collaborate. Also, administrators, other employees who support your service. So again, anyone that's outside of your service that even is still within your organization, again, put them on the list because again, they're going to be able to help you with your service as well. Now, a question that tends to be asked is from the 2017 and previous, do you still need to have annual meetings to kind of meet the requirement? And no, it is no longer required to have annual meetings, but you could still hold them annually if it does seem to meet the needs of your external stakeholders. If it's easy to get everyone together, by all means, but it's not a requirement. And knowing how hard it is for people to get together, it's sometimes, again, a nice one thing off of your plate that you don't have to worry about having annual meetings. But other methods to obtain external input. So again, in-person is lovely. I'm not gonna say it's not, but again, you can do surveys, phone calls, emails, even informal in-person conversations. Yeah, again, we've done that so many times, even within our service, that again, having some of the inpatient folks kind of coming over and just kind of having some discussions and say, let me run this by you. What do you think of this? So again, by all means, documenting all of these types of external input to show how those stakeholders are assisting in making your service the best that it can be. But really, bottom line, any form of communication is going to be acceptable as long as you're getting that external input and advocacy to improve your service. Now, here's just an example of documentation from my service at the University of Chicago. So again, just this is, I had to blank out because some of these are patients. So again, certainly, again, I have patients that, parents of a patient that works in our service, works outside of our service, but within our organization, our pharmacist, our social worker, one of the inpatient educators who's also a patient of ours, some pharmaceutical, medical liaisons, representatives, again, our billing representative is is also, part of our external input as well. So kind of think of kind of the whole scope of that. So with that, let's take a look at an example from another recognized program.